In this lecture, we are going to discuss the benefits of good posture and how to work with clients who have musculoskeletal deviations. We will then move on to the actual functions of the musculoskeletal system in the body and how these movements are applied to exercise. When you have good posture, your muscles are in balance and your body is symmetrical. Good posture has many benefits, such as ease of movement, balance of muscle strength and flexibility, proper positioning of the spine, and proper functioning of the internal organs. When you have good posture, your body feels good, and therefore, you feel good. Posture affects how you walk, run, jump, lift weights, and execute other skills. Strengthening and stretching the necessary muscles to create good posture can not only prevent injuries, but help rehabilitate injuries as well. To evaluate your posture, stand with your back against a wall. Your heels, backs of calves, glutes, upper back, and head should comfortably touch the wall. If you must strain to make all points of contact, then you probably have some deviations. Musculoskeletal deviations can result in poor muscle balance, poor flexibility, and improper spinal alignment, and can predispose you to injury. The relative strength and flexibility of the spinal muscles play a role in the alignment of the trunk and pelvis. When there are imbalances, three abnormal conditions can result: lordosis, kyphosis, and scoliosis. In the figure provided, you can see an example of normal posture, as shown by the first individual, and three examples of postural deviations. The second figure is an example of lordosis, where there is an exaggerated curve of the low back. The third figure demonstrates kyphosis, or exaggerated curvature of the upper back. Lastly, in the third figure, we have an example of scoliosis, or lateral curvature of the spine. Most people have some alignment deviation. As a result, the body does not work at maximum efficiency. When the body is misaligned, stress is placed on particular joints and movement becomes abnormal. In addition, your muscles must now work harder to compensate for the imbalances and maintain stability. Muscular tonus is the continuous and passive partial contraction of the muscles that helps maintain posture. Tonus is associated with blood circulation and economy in movement. Misalignments can cause excessive muscular effort that can produce fatigue, and, in more severe cases, strain the joint sufficiently enough to alter their structure. Correcting misalignments helps the body to work more efficiently and improve skill execution. The key to having a well-aligned and balanced body is to proportionally develop the muscles on one side of the joint with the muscles on the other side of the joint. In other words, create balance between the agonist and antagonist muscle groups. Only in this way will the muscles keep your joints in the natural state and not allow any deviations to occur. The spine is the keystone of body structure. It not only supports the weight of the head, trunk, and upper extremities, it also serves as a solid point of attachment for most of the trunk and shoulder muscles. Although we, as fitness enthusiasts and athletes, tend to be conscientious of form when we are in the gym or on the playing field, it is the day-to-day activities that can lead to back pain. For example, everyone spends a considerable amount of time sitting, and what a lot of us don't know is that intradiscal pressure in the spine when seated is up to 11 times greater than lying down. Since sitting is inescapable for most of us, the best advice is to limit time spent sitting as much as possible and design your workplace according to correct ergonomics. Ergonomics is the science of designing the job, equipment, and workplace to fit the worker. Your feet must be sufficiently strong to keep your body equally balanced and your shins in line with the feet, head, trunk, and upper extremities. Deficiencies in foot strength or stability can result in lateral tilt of the pelvic girdle, shifting the spine and head. Many bodybuilders and athletes have a forward tilt in the pelvis, which can cause excessive arching in the lower spine. If accompanied by a lateral pelvic tilt, symmetrical action of the lower trunk muscles can be affected. Asymmetry in the pelvis, either forward, backward, or lateral, can result in imbalances between the hip flexors, abdominal muscles, back extensors, and gluteal muscles. We will now address the major joints and muscular function of each. You may notice in this next part of our lecture that several muscles have actions on more than one joint. Some muscles can cause flexion in two adjacent joints, whereas others may have a role in flexion or extension in one joint, but stabilization in another. Rather than thinking about isolation of body parts, you should learn how the muscles work together as you do a particular exercise to truly understand what is occurring. Thinking in this manner, movement of joints rather than individual muscles, you can better understand what muscles play a major role in how exercise is executed. This will increase your understanding of how muscles can best be developed, as well as how to prevent injury. Let's take a look at the knee. The ends of the femur and the tibia bones make up the knee joint. The muscles of the knee joint are predominantly two-joint muscles. This means that from origin to insertion, the muscles cross two joints and thus can produce an action at both joints. The hamstrings, rectus femoris of the quadriceps group, gracilis, sartorius, and the tensor fasciae latae muscles are two-joint muscles that can act on both the knee and the hip. The gastrocnemius is another two-joint muscle of the knee, which also crosses the ankle joint. This is the major muscle of the posterior shin and functions to extend the foot. It ties in with the hamstrings at the knee joint, where they are both involved in knee joint flexion. In addition, the insertion of the gastrocnemius on the femur helps to provide greater stability. The muscle mass of the quadriceps is much greater than that of the hamstrings. The quadriceps should always be stronger than the hamstrings in almost all instances, for their workload is much greater. The ankle joint is made up of the tibia and talus bones. In addition to flexing the knee, the gastrocnemius is the major ankle extensor muscle of the shin, which allows you to point your toe. The soleus has similar functions to the gastrocnemius. The tibialis anterior is the main muscle on the anterior side of the shin and functions to flex your ankle and turn the sole of the foot inward. The spine, or vertebral column, is the most important functional unit of the body. It provides the main framework and foundation for most of the movements of the body and extremities. The abdominal musculature is made up of the rectus abdominis, internal and external obliques, and transverse abdominis. These muscles provide stability in the spine by acting to prevent the vertebral column from being continually hyperextended. The hip flexors, which cross the hip joints, are the iliopsoas, pectineus, and rectus femoris. These muscles work together with the rectus abdominis and external and internal obliques to create maximum ROM in your ability to raise the legs as high as possible. The bony arrangement of the shoulder joint consists of a shallow socket, glenoid fossa, into which the spherical head of the humerus fits. The muscles that serve as the primary movers of the arm at the shoulder joint are the deltoid, coracobrachialis, pectoralis major, latissimus dorsi, teres major, the long and short heads of the biceps, and the long head of the triceps on the posterior side. The muscles located on the front of the chest and shoulders are involved mainly in flexion and horizontal adduction, while those on the posterior side are involved mainly in extension and horizontal abduction. The shoulder girdle is made up of the clavicle and scapula. All movements of the scapula are usually considered movements of the shoulder girdle. The trapezius, serratus anterior, pectoralis minor, and rhomboids are all part of the shoulder girdle and are involved in the following movements: elevation, depression, upward rotation, downward rotation, protraction, abduction, and retraction, adduction. The shoulder joint muscles are responsible for moving the arm, while the shoulder girdle muscles, which work in synchronization with the shoulder joint muscles, are responsible for moving the scapula and clavicle. The muscles work closely with one another to ensure smooth, full range of motion in the shoulder joint. The ends of the humerus and ulna bones make up the elbow joint. The muscles on the anterior side of this joint are the biceps, brachialis, brachioradialis, and pronator teres. The posterior muscles on the backside of the elbow are the triceps and anconeus. The actions of the triceps and biceps muscles at the shoulder joint are secondary to those at the elbow joint because of their attachment to the scapula. When doing elbow flexion or extension exercises, the muscles of the shoulder joint must contract to hold the shoulder and arm in place to be stabilized. The radio-ulnar joint is a combination of three joints located at the wrist, elbow, and in between the ulna and radius bones. The muscles of the radio-ulnar joint act as stabilizers and produce either pronation or supination. This includes the biceps, supinator, pronator teres, and pronator quadratus. The wrist joint is made up of the ends of the radius and ulna bones and the carpal bones of the hand. The flexor carpi radialis and extensor carpi radialis are responsible for wrist abduction. The flexor carpi ulnaris and the extensor carpi ulnaris are responsible for wrist adduction. The wrist flexor and extensor muscles have a role at the elbow as well as the wrist. At the elbow joint, the muscles are relatively weak, and their angle of pull is more into the joint rather than the forearm. Thus, their function is to act more as stabilizers during elbow joint exercises. By looking at specific exercises, it is possible to see even more clearly just how the muscles function together, and how some of the biomechanical principles apply. By having a stronger comprehension of the importance of good posture, as well as proper biomechanics and kinesiology of the major muscles involved in resistance training exercises, you can successfully select appropriate exercises that will optimize the muscle potential for yourself and your clients.